Hello, welcome to Getting Started with Vision Loss, APH Connect Center resources that help older people cope. Our objectives for this session are to define the Connect Center and VisionAware, to learn critical steps that older people and their families need to take when they're facing vision loss. We'll understand how to recognize someone with low vision. We'll explore the VisionAware website sections as well as the Getting Started guide for people who are new to vision loss. And we'll discuss strategies that you can use to help support older people with vision loss. The APH Connect Center is a department within the American Printing House for the Blind. We have three distinct website programs with three very specific audiences. One of our websites is VisionAware, which is aimed toward older people who are new to vision loss. We have a robust webinar program suitable for adults with low vision, their families, and related professionals. We also have a directory of services with over 2,000 agencies and organizations serving people with low vision. And we have an information and referral line. Many people are not aware that there are services out there to help them adjust to life with low vision. They can learn new skills so that they're able to remain independent and to continue enjoying life. VisionAware fills the gap between getting a diagnosis and getting help. VisionAware is also a very useful resource of information for professionals and providers who support older people with vision loss. It's estimated that our vision does change with age, but there are some things that are not normal changes. And some of those considerations are if you're working with someone who's consistently bumping into things, they're shuffling their feet, or maybe they step hesitantly, they overreach for items, or they've changed how they do tasks such as writing, watching television, driving, walking, or engage in activities. Maybe they're even having trouble identifying faces or known objects. These are all signs of vision loss and should be considered. There are some critical steps that need to be taken when someone realizes they're dealing with vision loss. They should first talk to their healthcare provider and ask about a dilated eye exam. This will help identify what is going on and what the issue is. They also need to ask their eye doctor about information related to vision rehabilitation services and low vision services. And lastly, they need to research how and where to get support and services. That's where VisionAware can help. There are over 25 million people in the United States currently living with vision loss, and this number is expected to rise. The Centers for Medicare and Medicaid Services estimate that most people do not learn about vision rehabilitation services from their eye care professional. This is where you come in. As a professional working with someone with low vision, you have access to VisionAware as well, and you can connect people to these services that are very much needed. On the VisionAware website, you will find useful tips and resources for older people with vision loss, their families, friends, and related professionals. You'll find information on eye diseases and disorders, as well as the functional aspects of living with vision loss. You'll find the Getting Started guide for people who are new to vision loss in English and Spanish. There's information on support groups, as well as our VisionAware and Peer Advisors blog. There's just a robust set of resources available. I'd like to take you on a brief tour of the VisionAware website next. This is a screenshot of our homepage. Across the top, you can see that we have the various sections of our website, and we'll get into those in a moment. Along the right-hand side, we have our contact information, including our information and referral telephone number, our email address, our searchable directory of services, which is searchable by state or category. We have a quick link to our Getting Started guide for people new to vision loss and more. We also have the VisionAware blogs. As I mentioned, we have two blogs. One blog is titled Visually Impaired, Now What? This blog is authored by our VisionAware peer advisors. They themselves have been living with vision loss as older adults. So this is really an interesting blog all about their insights and experiences. Then we have the VisionAware blog, which covers topics such as diabetes management with low vision or the ins and outs of the low vision exam. We have a section all about eye disorders and conditions. You learn about things here such as cataracts or glaucoma, macular degeneration or diabetic retinopathy. We have definitions of blindness and legal blindness, as well as a glossary of other vision related terms that may be useful. This is an especially helpful area of our website, and many people start here first when they get a new diagnosis. We also have a part of the website called Everyday Living. Everyday Living is a section of the website that is extremely useful for people who want to know how to live with low vision. This covers essential daily living skills, everything ranging from personal hygiene and grooming all the way to religion and spirituality and everything in between. There's information on support groups, information for veterans. There's information about useful tools and technologies around the house. There's information even about home repairs and hobbies, lots of useful stuff there. We also have some guidance for families on the website. When someone begins experiencing vision loss, it doesn't just affect that person, it affects the whole family. There is definitely an emotional impact that needs to be considered, especially if the family is living with the person who is experiencing vision loss. There are steps that can be taken to help someone get the services they need. And to that end, we have a roadmap for services for someone new to vision loss. We also have the Getting Started guide for people who are new to vision loss. This is a booklet that was published in 2020. It is available for download from our website, as well as it can be ordered in large print from our website. We have an abbreviated audio version of the Getting Started guide, and that can be heard by calling our information and referral line and following the audio prompts. The Getting Started guide has been broken down into several areas, but we cover things like how to make the home a safer and more enjoyable home place for people with vision loss. We talk about tips for recreation and leisure, suggestions for being in the kitchen and cooking safely. There are tips on setting up a home office to be the most efficient and accessible as possible. There's also a section all about transportation, and this is especially useful for people who may no longer be able to drive. We talk about home modifications. There are several things to consider when modifying a home for someone with low vision. The use of high contrast wherever possible, that is essential. Lighting should be considered. Clearing all obstacles wherever you can. And marking dials and displays or buttons that are flat with tactile stickers. You can see in these images some examples of high contrast and bright lighting, as well as tactile stickers on displays. These are very useful suggestions in the home. We also talk about creating a labeling system that works for you. And we encourage you to get creative with this. And the people that you support who are experiencing vision loss, you can suggest things as simple as putting a rubber band around a bottle of shampoo to differentiate it from a bottle of conditioner. We talk about how to source accessible kitchen and household gadgets. We also talk about the use of large print or tactile checks, check writing guides, bold line paper, recorders, and the like. If you are a professional who's working with an older person experiencing vision loss, there are some things to consider. Consider your own feelings and beliefs about vision loss and what that might convey. Also, remember that emotions play an important role in being able to move forward, and adjustment takes time. Communicate effectively. Provide materials in large print or audio. Don't rely on facial gestures. Introduce yourself. Describe images if needed. And lastly, help people find the services they need. The directory of services on VisionAware is a very large directory database with over 2,000 agencies and organizations serving people with vision loss. It is searchable by state or by category, And there is just a wide variety of programs and services available, and we cannot recommend utilizing this resource enough. It is a very valuable tool. Lastly, I want to talk with you about our webinar program. We have both live and recorded webinars. It's our goal to have at least one webinar per month on VisionAware. We recently had a webinar about the impacts of vision loss on the entire family. We had a webinar about insider perspectives of vision loss later in life. We currently have a webinar series all about diabetes management for people with low vision and how to manage it independently. So these are just a few of the things that we offer on the VisionAware website. Thank you so much for joining me today. I hope you've learned a little bit about the American Printing House for the Blind Connect Center and visionaware.org. If you'd like to reach out to us, you can visit our website at visionaware.org or our hub website at aphconnectcenter.org. You can reach out to the information and referral line or email us at connectcenter@aph.org. Thank you so much.